Welcome to the Aboriginal Head Start on Reserve virtual recording on Aboriginal Head Start on Reserve licensed childcare conversion spaces funding presentation. Before we get started, we would like to take a moment to acknowledge the individual territories in which we are all watching this presentation. During the presentation, we will review the following: background information on this funding opportunity, the sample application form and the sample budget template, a few definitions, frequently asked questions, and at the end of the presentation, we will speak to how you can connect with us for further support. This is the staff from First Nations Health Authority that are participating in this presentation. At the end of the presentation, you will find the contact information for each FNHA Regional Head Start advisor and other team members. Your Regional Head Start advisors are here to support you and your community as you proceed. Please note, myself, Denise Lacerte, and Bonnie LaBounty will support the Vancouver Island region. Since 2017, FNHA has partnered with MCFD on several Aboriginal Head Start on Reserve initiatives. The latest initiative is the ASOR Licensed Childcare Conversion Spaces Funding. BC Budget 2021 supports reconciliation through a range of new investments that support the health and well-being of Indigenous peoples and communities. This includes $20 million over 3 years to add 400 additional spaces to the Aboriginal Head Start programs in the province. $8.66 million in operational funding is allocated per year to convert 400 Indigenous childcare spaces to the Aboriginal Head Start program model, making them no-fee, holistic childcare programs inclusive of wraparound family supports and inclusion. To achieve the goals of the next expansion project, the Ministry of Children and Family Development has again partnered with FNHA and Aboriginal Head Start Association of BC. FNHA will receive up to $4.33 million annually to do this work, converting 200 childcare licensed spaces on reserve, potentially converting approximately 40 spaces per region.
Aboriginal Head Start on Reserve programs are BC First Nations community-based, no-fee early learning and childcare programs that supports children ages 0 to 6 years old and their families. ASAR programs focus on 6 main components: culture and language, education, health promotion, nutrition, parent and family involvement, and social support. Communities make different choices about how to best use their ASAR funding, taking in account of community size, number of children, existing services and capacity, isolation factors, and transportation challenges, as well as family and community needs and priorities and availability of staff. Some communities use ASAR funding to supplement and enhance existing programs and link with other funding sources, while others use funds to create programs where none had existed before. Communities deliver their programs to meet the needs of their community, such as daycare and or preschool with after school and outreach model. For this funding, successful applicants will engage in a FNHA set health agreement and will deliver ASOR childcare with this funding. If you require further support and or regional information about the ASOR program, please visit our website page. Time. of activities. Applications are due Thursday, October 21st, 2021 by 4 p.m. Late applicants will not be accepted. Applicants reviewed and internally processed between October to November and approved by FNHA Senior Executive. Funding and new community agreements will be in place January 2022. Communities will be required to submit regular status reports. All projects must be operational before March 31st, 2022, under the current pandemic conditions. Communities must agree to provide regular status updates and reporting as requested by FNHA in order to be eligible for this funding. All communities need to be in good standing with FNHA, reporting and accountability to be eligible to qualify to receive this funding. All current part-time ASOR funded and unfunded licensed childcare programs whom are seeking to operate full-time are able to apply for this funding through FNHA if they meet the eligibility criteria.
Funding timelines of activities and key dates. Step 1, application and presentations are made available September 28th and September 29, 2021. Step 2, communities complete application. Step 3, application due before 4 p.m. Thursday, October 21st, 2021. Step 4, applications reviewed, internal decisions finalized. Step 5, communities receive notification in December 2021 and funding agreements will start January 2022. Step 6, license programs must be fully operational before March 31st, 2022. Step 7, communities submit updates, reporting as defined in their funding agreement. Eligibility. To be eligible to apply, you must, 1, be an existing licensed BC First Nations on reserve childcare facility or a soon to open facility, but must be operational by March 31st, 2022. First priority will be given to unfunded First Nations on reserve licensed childcare programs offering full day fee-based services. Second priority will be selected upon applications that meet all other eligibility criteria. Number 2, be a child care program that is already accessing child care operating funding, otherwise known as CCOF, and the Child Care Fee Reduction Initiative, otherwise known as CFRI. Be a half-day or part-time licensed Aboriginal Head Start program may also be eligible to increase delivery to a full-time Aboriginal Head Start childcare. Please keep in mind the intent would be that the childcare program would be in full operation 12 months per year. Number 4, be in good standing with First Nation Health Authority reporting and accountability. Number 5, submit a copy of your current childcare license if you are an existing licensed BC First Nations on reserve childcare facility. For the soon to open facilities, you must submit documentation that confirms your licensed childcare facility will be open and fully operational before March 31st, 2022. For an example, an email or confirmation document that demonstrates your application is in the full process with the childcare licensing officer. Number 6, submit your fully completed application to the deadline of Thursday, October 21st, 2021 by 4 p.m. Please note, communities accessing this provincial Aboriginal Head Start on Reserve funding stream will not be eligible for future provincial funding, such as CCOF or CFRI and Aboriginal Supported Child Development funding. Nor will families at these sites be eligible for the Affordable Child Care Benefit Subsidy, as this is a single funding stream model offered at no cost to families. So what does that mean for you? Well, these provincial funding streams will be replaced by the Aboriginal Head Start on Reserve childcare conversion funding, and you will only have one provincial funding report. Please note, you can also reach out to your regional Head Start advisors who can further support you. Just a kind reminder that the Vancouver Island region, you can reach out to Denise Lacerte or Bonnie LaBounty. You can submit your application to our email address at the hcyd@fnha.ca or via fax 604-666-3867 before Thursday, October 21st at 4 p.m. Applications submitted after the deadline will not be accepted.
We are now going to discuss each section and review the sample community application for a multi-age program that is licensed for 8 children. For purpose of this presentation, we have created a fictitious community to demonstrate how to complete this application. In section 1, it talks about community information. And here we are asking for your community and program name and contact information. We may need to be in touch with you to follow up on your application. If and when the primary contact is not available, we ask that you list up to 2 other contacts who are knowledgeable about this application process that we could contact for further information if required. This screen shows section 2, which is community need. Here we are asking you to tell us how many children are in each category. So on the screen, you can see that it's a licensed multi-age childcare program. In the next section, we want to learn if you have applied for the MCFD New Spaces childcare funding. Here we ask you to thoroughly describe your current licensed childcare enrollment situation and identify any barriers or successes regarding enrollment. We need to have a thorough picture of what's happening in your community and your program. Please include any strategies that you have applied to address your situations. I'll just pause briefly for a second so that you can review the example in the boxes.
Here we look at section 3, community readiness. Here we ask you to describe your organizational process related to operations, administrations, and management. This FNHA ASOR childcare conversion project requires an internal coordinating approach, such as delivering the ASOR 6 key components into your overall programming, incorporating the ASOR 6 key components into your daily schedule and curriculum, submitting narrative and financial reports on time, managing budgets by coordinating with the finance team or your bookkeeper. I'll take a minute to read this over. Community readiness continued on. Here we ask you to describe your current childcare employees and community involvement level prior to COVID. We know many things have changed during the COVID times, and we are asking you to share your information pre-COVID. Take a minute to look.
Section 4, childcare conversion, transition plan, and financial information. Please use this section to explain the line items of your listed revenues. You can see the picture here on the right as an example. You will see in this example of the sample application that we have listed 0 for parent fees. In the box below here, we've explained why. Please use this space to describe in full detail your current childcare financial overview. Carrying on with question 18, program budget 2020 to 2021. You will need to attach your budget from April 2020 to March 2021. We want to see a full fiscal. That's why we're asking you to use the 20 to 21 fiscal, because if we ask for the current one, it would only show 6 months, and we want to see the expenses for a full year. It's important to show staff costs, including wages and benefits. So here you can see that there's a breakdown of that in this gray area. You will see that we provided a sample budget worksheet to refer to and a template if you need one. However, if you have your own documents, then please attach those instead. This section is crucial for you to fill out with as much detail as possible, as it helps us understand your financial situation and the funding you would require to convert your existing licensed childcare spaces over to a fully funded Aboriginal Head Start spaces on reserve. Carrying on with section 4, question 19. Here we ask you to describe how you would create your ideal Aboriginal Head Start on Reserve program using the FNHA ASOR Child Care Conversion Funding. Please highlight any enhanced staffing level changes, such as staff to child ratio and wages and benefits, identifying what steps your community will take to transition into this new delivery model, and how you plan to involve employees, community members, funding partners, and other community partners. Identify what supports you may require from your regional Head Start advisor. I'll just give you a moment to read through the example. Okay. Still on section 4. So again, we have provided you a sample budget worksheet to refer to if needed. You will find this section under the tab labeled Human Resources Costs. In question 20, we are asking you to tell us about your current employee qualifications and wages. Tell us about your current employee wage grid and benefit package for your childcare staff or childcare program or within your community. If you have a community wage grid, we're only asking for the childcare employee wage grid if that exists. We don't need to see other positions in your community other than the childcare. Please tell us if you received the BC Act's wage enhancement funding and the supplement to the base wage that you have, how you've applied that. So there's lots of detail in here, so I'll just give you a moment to review this.
Are you guys able to hear me?
Nope, now we are.
Okay, thank you. I was wondering, sorry about that. Thank you. Here we have question number 21. In this section, this is where we would like for you to tell us what your childcare rates are for your program, both full-time and part-time. Section 5, other information. Here we ask you to use this space to share other comments or other related information.
Here we ask you in section 6, community acknowledgement. Here we ask you to tell us if you're in good standing with First Nations Health authorities, narrative and financial reporting, and accountability. Here we require you to submit a band and council resolution, also known as BCR, in support of this project in order to complete your application. Give a moment to read it. Carrying on to section 6, community acknowledgement. Here we ask you in number 5 to submit the signed acknowledgement statement that we have provided for you.
Slide 23 shows that we have provided you with an application checklist. So number 1 is for you to review the sample application. Number 2 is submit your own completed application. All the questions must be answered, as incomplete applications will not be considered. Number 3, if your community has an employee wage grid and/or a standard benefit package, please attach copies of those. Number 4 is attach a previous program budget from April 2020 to March of 2021. You may use your own document for that, or else use the ASOR FNHA sample application budget template that we've provided. Number 5 is please attach a copy of your community care facilities license. For soon to open facilities, you must submit documentation that will confirm your licensed childcare facility will be open and fully operational before March 31st of 2022. Number 6 is submit a signed BCR before Thursday, October 21st, 2021 by 4 p.m. And finally, number 7 is submit the application to the email hcyd@fnha.ca, or you can fax it to 604-666-3867, and again, before October 21st, 2021 by 4 p.m. Any applications that are submitted after that deadline cannot be accepted.
Appendix 2, definitions. Here are a few definitions that you will need to know. The Child Care Operating Funding, otherwise known as CCOF. This is base funding that assists eligible licensed family and group child care providers with the day-to-day costs of running a facility. Child Care Fee Reduction Initiative, otherwise known as CFRI, enhances child care affordability by offering funding to eligible licensed child care providers to reduce and stabilize parents' monthly child care fees. Child care providers must apply to receive this funding. Parents do not need to apply. Affordable child care benefit. This is a monthly payment to help eligible families with the cost of child care. Factors like income, family size, and type of childcare determine how much support families can get. Aboriginal Supported Child Development, otherwise known as ASCD, enables children who require extra supports to be included in childcare settings, preschool, before and after school, and community care settings. Now we are going to take a look at some of the frequently asked questions that can be found in Appendix 3. Employee wage grids. Do you have a wage grid, or is there a standard for childcare? The topic of wages and benefits can be a challenging discussion as there's so many variables that can affect the bottom line. First Nations Health Authority does not make recommendations in regards to wage compensation amounts for our funding arrangements. It's hard to compare from one nation to the next because communities can only pay staff based on the revenue they receive. So it's comparing communities can be kind of like comparing apples to oranges. We are aware that there is a provincial ECE wage grid being developed. However, FNHA acknowledges wage grids and benefit packages are determined by BC First Nations communities. For example, the Community Health Office or Health Director and Band Council. Please keep in mind the Aboriginal Head Start on Reserve program is a free program for families. Some communities do have their own employee wage grid. Besides revenue, there are many inconsistent variable factors that influence wages and compensation that include staff qualifications, budget items such as rent, admin costs, travel, etc., and the caseload of staff ratio.
Slide 26. We are almost ready to move into our new facility, and we will have our official license in October of 2021. Can we still apply? This funding is for existing BC First Nations on reserve licensed childcare or the soon to open. For the soon to open facilities, you must submit documentation that confirms your licensed childcare facility will be open and fully operational before March 31st of 2022. For an example, provide an email or confirmation document that demonstrates your application is in the final process with the Childcare Licensing Officer of BC. Next question. We don't access CCOF or CFRI funding. Can we still apply? BC First Nations licensed childcare programs must be already accessing childcare operating funding, which is CCOF, and the Child Care Fee Reduction Initiative, which is CFRI, in order to be eligible for this funding. If you are a soon to open facility, you must be licensed and operational by March 31st, 2022 in order to be eligible to apply. Next question. We don't really plan for ASCD funding as we don't often know when and if we will require that extra support. So how do we plan for this? This is where we encourage you to consider enhancing your staff to child ratios and include this in your ideal budget. This funding supports an inclusive, holistic wraparound approach for families who attend your childcare program.
Frequently asked questions continued. We receive wage enhancement funding from BC Aboriginal Childcare Society, which is also known as BCACS. Will we still be able to receive this funding? Yes, this should be demonstrated in your submitted 2021 budget. Next question. We are an existing ASAR program. However, we only offer half or part-time. Can we still apply? Applicants must meet all of the eligibility requirements in order to apply. For example, if you are a licensed program and receive CCOF and ASAR funding, and you currently provide a morning preschool with an afternoon licensed childcare, you would be eligible to offer a full-time all program for families. Please keep in mind, there is a no fee for families who attend and an Aboriginal Head Start on Reserve program.
We have received a licensed full-day daycare and a part-time after-school program, but we are not funded by a SOAR program. Can we still apply for this funding? And what type of agreement is there here? Yes, you are eligible for this funding if you are an existing First Nations licensed childcare program and you are accessing CCOF or CFRI. You don't have to be an existing funded ASOR community to apply for this funding opportunity. Candidates who are successful for this funding would then convert from a childcare program model where you collect parent fees or access provincial grants or funding. Then you would convert to Aboriginal Head Start on Reserve funded program with FNHA and operate an inclusive no fee program. A health funding agreement would then be developed between FNHA and your community in order for your program to be converted to this new model. If we receive this funding, is it true that we can no longer apply for the childcare operating funding CCOF and CFRI? And what will happen going forward? So going forward, successful applicants would then receive the provincial ASOR childcare conversion funding stream. They will not be eligible for CCOF, CFRI going forward, nor will the families at the programs be eligible for affordable childcare benefits. The reason that you're not receiving those funding is because this funding is meant to be all inclusive and replaces the existing provincial funding sources. One of the goals is to ease some of the administrative responsibility and provincial reporting requirements. Your previous provincial funding streams will be replaced by Aboriginal Head Start on Reserve childcare conversion funding, and parents will not pay for childcare.
Slide 29. Does this funding allow for any startup costs or capital? No, there is no startup costs or capital available as the programs are expected to be fully operational. Next question is, we have a huge wait list. Can we add more licensed spaces to our existing license? You must meet all of the eligibility requirements for this funding. Extra spaces require licensing approval. This funding does not include any startup or capital funding. Next question. I'm having a problem sending all the attachments required for my application to be complete. Is there any way I can make this easier? Yes, you can send multiple emails to the HCYD email address with your properly labeled attachments. Make sure to clearly identify in each of the email subject lines your community name and attachments. There's also a free online service called WeTransfer. It allows you to email multiple documents up to 2 gigabytes in total size all at once. You can choose to create a free account or send your documents through as a one-time guest.
You may have further thoughts or questions after hearing this recording. Here is the contact information for the First Nation Health Authority staff. We acknowledge that this funding is not enough to fund all of those in need. However, it is a starting point and a place for us to further grow Aboriginal Head Start on Reserve. And final, we would like to offer our gratitude for attending this presentation and look forward to supporting you as you proceed with this funding application, sharing all our relations.